We are about to start this study session for the Sumner County Board of Education for July 14th, 2020. Before we do, I'm going to stand for a moment of silence, followed by the Pledge of Allegiance to our country's flag. Anyone who feels like they would like to join us, please feel free to do so. Join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Once again, I'd like to welcome everyone that's in the house tonight. We appreciate you being here. Those that are watching from live stream, glad to have you there. I think that was a great decision to be made so that we could get more people involved and more people could see what was going on and not have to drive to Gallatin and do it. And so hopefully it helped keep some people safe and get you the information that you need as well. A little bit of housekeeping. We got a lot of information tonight, and so we're going to turn it over to Dr. Phillips in just a minute or two. So if y'all would, the board members, kind of keep an eye on me when you turn your lights on. I'll try to catch you as you turn them on and let everybody go in sequence in their turn. If you've already spoken and there's somebody and you light your light up, somebody that hasn't spoken, I'll probably go to them first and that way we'll get everybody an opportunity to speak. And so with that being said, meetings up and running, and we'll turn it over to Dr. Phillips.
Thank you, sir. It's good to see everybody. You know, we typically don't have a July study session every year, but obviously this is an important one that we wanted to have and get input from you guys. Also tell you about the work that we've been doing for months now, trying to get ready for the reopening of our school system. And we're excited about that. We think we have a really good plan. We've obviously, like probably all of you, have looked at other districts, neighboring districts, and districts even in other states and other locations to try to see what other places are doing and considerations that they're making. And I think we have a detailed document, one that probably has, in my opinion, a little bit more detail than some others that I've seen. And then we'll go through, obviously, all of that step by step tonight, and then talk about kind of what we have on our mind as far as August 3rd. I want to start out by thanking everyone that's had a part to play in this. And so sometimes kind of at this level, we don't give you guys the detail necessarily about how these types of large district movements and plans happen, and I want to be sure and thank all of the people that had a part in this, because I was just really just a very, very small part. But our leadership team here at the district level obviously was crucial in continuing to not only do things for this plan, but tonight you'll see, especially in the instructional world, you will see things that require many, many steps and processes behind the scenes to make that one thing happen. And so it's many, many layers to make one particular adjustment occur with any degree of success. And so they've been instrumental. Our principals, our campuses. Tonight we'll talk about the district plan, but weeks ago we brought principals in and had a working group and talked with them about what we were thinking, what questions did the district need to answer so principals wouldn't have to answer those things that needed to be consistent across the school system, and then how could we best help them prepare for their individual school campus. And from that we were able to work through a lot of the things that you see in the district document, but we were also able to create, through their help, a template so parents would be able to see an individual school's plan for certain areas that are specific to their building and their campus that will be different across the entire school system, but we tried to answer the same questions for every school. Does that make sense? So that template was consistent so parents would see some consistency across the school district. And so I think that was a good thing, and they helped us tremendously with that. Also, want to make sure and thank the teachers and the parents. At one point, I think later this evening, Mr. Langford and his group are going to go through some of the results of the surveys. But not only with the survey information, I'm sure you all have had a lot of feedback from teachers and from parents. And so we have as well. And, you know, can't thank them enough for trying to explain their concerns and what they're looking for. And then how can we incorporate that, or at least answer those questions for parents and for teachers while we try to plan and reopen schools. I say all that to say that I'm proud of what we've produced. I think it's a very good document, a very good plan, but it is not a perfect plan because we're dealing with a pandemic and we're dealing with things that we've never done before. And while we have an exceptional group of people in Sumner County, we also understand that sometimes we make a plan and then we learn new information and we change the plan. So regardless of what you see tonight or as we move forward, you have to remember that we have to give ourselves some flexibility in the plan. Regardless of how detailed it is, you're going to have to understand, just like we do, that there may be specific portions of it that we have to revisit as we go throughout the start and the beginning of the school year. A little bit about the flow of information, and then we'll get started with the document. First off, we're going to talk a lot about operational things, and that's some of the stuff that parents probably have the biggest and largest questions about, and we've included that in a document that we're going to hand out to you here in a second so you can follow along with us. So that'll cover a big portion of the first section of the meeting, and then I'll probably see if the chairman wants to take a break because you'll be ready for one by then. And then we'll turn around and have some school-specific, I think Mr. Langford had lined up some school-specific plans. So we wanted you to see kind of what I was mentioning about how the principals helped us work on the plan and then create a template for all schools to use. And we'll probably, I think we'll have, Scott, what, two or three? Three principals that will get up and talk about their specific plan for their school. And so you can kind of see how those work together. So parents have a little bit deeper understanding about their particular child's school. And then we will talk about instruction, and we'll take another break probably. And then Mr. Langford and his team are going to really talk about the supporting teaching and learning section that's in this document and expand on exactly how we're going to deliver instruction regardless of what learning platform we're in at any point throughout the year. So that's kind of how the flow is going to go. Operational, then school specific, and then supporting teaching and learning with Mr. Langford and his team. A little bit about the release of information. Obviously, Mr. Brewer mentioned that we're live streaming this, and that's great. I think we probably will have a lot of parents that will watch this, and I think that's a wonderful thing. Tonight we will post the actual document that you're going to review. We will post that online this evening after the board meeting. And then tomorrow morning, there will be the school-specific plans will go out through the website and through messaging from the building principals to their parents, okay? So that's kind of how that flow will work. In the operation portion, you'll see a lot of protocols and things that steps we're going to take around student safety, staff safety. But in the instructional portion, like I mentioned before, you'll see a lot of flexibility because we may be in a situation where we move between hybrid or traditional models within the school year. I think it's important to say that we mentioned this the last time, but it's important to remember the goal that we have. We set at the last meeting, which I think is still true and consistent. Our goal is to support student learning across multiple platforms, considering every possible precaution for the health and safety of students and staff. That's really what we're trying to do. And I think that we've been focused and working hard to make that happen. We do believe that in-person learning is the best. We fundamentally believe that is the best option. We also realize that our plan is trying to maintain that and maximize that time, but also consider all the health and safety factors that we have to consider to be able to do that in the safest way. Really kind of focused around three questions. What's best for students? Not only academically, but emotionally, socially, and from a health perspective. And then what's best for staff? We have to consider our staff. And each one may have an individual unique situation that we have to work through. But I know that the overwhelming majority of our staff want to come back to school. They want to be on campus. They want to be with their children, their students. They want to be with their colleagues. And we know that because they've told us that. But we also know that we have some staff members out there that are nervous and have questions. We hope this document will help clarify a bunch of those. But it may not clarify all of them. But we're okay with that. We want teachers and our staff to reach out to us so we can try to, even if it's individually, work through those things. And then the last thing is, what can we implement with a high degree of success? I think we always have to go back to, we have this conversation sometimes around policy. It doesn't do any good to implement or create a policy if you can't implement the policy, right? So on each of these things, we have to say, can we do that? I don't want to just say that we're going to do that. Can we really do that? And can we do it with a high degree of success across the system? And so we may have that specific question come up as you look through the document. We work through some of those protocols. You may say, well, is this doable? Or why didn't you do something else? And we can have that conversation. And then at the end of the evening, we're going to kind of have a summary. We'll probably all be exhausted by then, but it'll be a good exhausted. But we're going to have a summary kind of at the end. And then what's next? That's the big question. What's next? And then probably my recommendation for what I think we should do at the start of the school year. Because at the end of the day, as we all work together to be thoughtful about how to do it, at some point we make a decision about this is what we think based on the information that we have right now, what we think is best. And so I'll be giving you a recommendation about what I think we should do to start the school year, okay? That's kind of how it's going to go. I'm going to pass these around, and I'll give you a second to get those. As I mentioned, all of this information will be available to our parents this evening. We're going to post it, and then we'll also email this particular presentation to all of our staff internal to the system. So on this opening page, does everybody have one? Yeah, just lay it right there, Mr. Wilkerson, thank you. So really, we're just calling this our pathway to reentry, and some considerations and recommendations for us. As a school system, we started out with our goal. Our goal is to support student learning across multiple platforms, considering every possible precaution for the health and safety of students and staff. The Sumner County Board of Education has developed guidance to support our schools and communities as we navigate reopening schools. Sumner County Schools Pathway to Reentry provides a tiered approach, which I think you'll see that, with clear actionable steps to be followed as students and employees return to school buildings, along with a plan that is applicable throughout the entire school year, because we want to make sure that we plan for the entire year, not just for the first 9 weeks or the first semester, because none of us really know how this is going to go beyond what we're experiencing today. Sumner County Schools Pathway to Reentry provides guidance to stakeholders as we prepare to begin the year. And then it says the Sumner County Board of Education will continue to evaluate and update the plan. And like I mentioned, we may be back to you with some adjustments to the plan because I think even though we have a tiered approach that gives us a lot of flexibility, we just don't know what we don't know, right? So things could change down the road, and we have to revisit it. And we want to be willing to do that and to say, hey, we have some other considerations here that we need to take into account. The last box really, I think, goes into a lot about the mindset of I think where we need to be. We all have a shared responsibility in protecting the health and safety of our school communities across the county during this pandemic, and ask for everybody's understanding, support, and cooperation. We realize that we're going to have opinions out there that may be favorable and some maybe that aren't so favorable about whatever decision is made. But I think if we go back to those 3 guiding questions, leading with what we think is best for students, I think we'll end with a good result. I really do. If you flip over this second page, kind of goes back through a little bit of how we had the graphic from the previous meeting in June. And you see that we have 3 real categories there that kind of in our mind kind of let us know where we're at as far as the health of our community. Minimal. In minimal, we're going to have the green box, school buildings open. We'll be implementing preventative practices. We may have targeted closures in our hybrid scheduling when we think that's appropriate based on the information that we receive. The green box basically splits into 2 things. One is traditional schedule. That's pretty easy to understand. That's basically school as normal, right? For everybody. And then we'll also have a virtual academy. And I know Mr. Langford's going to talk about that quite a bit. I mean, we've got some very specific information in his presentation about, and a little bit later in this portion under operation, about how parents sign up for that and what that means, all of those types of things. So the virtual academy will be an option that parents can choose. They can select that now to run for K-8, at least a 9-week commitment, and then for high schoolers 1 semester at a time, okay? And we did that because the thought process around that time frame, to organize staffing and to do that correctly, we needed people to make a commitment because we really couldn't manage going back and forth. So I want to be virtual this week, not virtual the next. You see what I'm saying? I mean, that was going to be too difficult to manage. So I think most systems that are offering a virtual option will have some type of time requirement similar to that, where parents that feel uneasy about going back to school, either in the traditional model or in the hybrid scheduling model, they can select that at the beginning of the year. And then, of course, if they want to continue on with additional 9-week segments in K-8 or in the second semester, then we'll obviously allow that to happen, okay, if they want to continue in that. A lot more to come about the virtual because that's new for us, okay? So we'll talk in great detail and depth about that. The moderate yellow box, school buildings are open, hybrid schedule, and potential targeted or short-term closures. And that potential targeted or short-term closures, that will become clearer as we go through kind of our protocol for informing parents about positives and those types of things, which I think those sections are way more detailed for us than they have been in any of the others that I've seen, which is one of the things that we thought parents would really want to know. But we could have situations where we have potentially a cluster outbreak, and that might be specific to that one school, even within maybe one grade or targeted just in that one particular building. And so we may have some targeted closures for a 10-day period of time just for that one school. Does that make sense? So that's kind of how we're looking at the targeted closure run. And then hybrid students will learn from home, but also be at school on particular days. and then supported by Sumner Connect and Google Classroom. Don't get too caught up in Sumner Connect and Google Classroom, because we're going to show you how to use those sites. I think Mr. Langford and his team, Gene, they're going to, in the third part of this, they're going to take you through and show you how that works, okay? So just know that information is coming. And then substantial spread, obviously that's when all the buildings are closed, similar to what we did back after spring break to finish the year. Staff will report to their assigned locations unless otherwise instructed, and then select students may be allowed on campuses with required distancing and cleaning and that sort of thing. We left ourselves an opportunity there that if we got into the substantial spread, we really don't know, depending on what time of the year it is and what things are happening, what that would look like as far as a complete shutdown of the campus. So it may look a little bit different in that box. We're all hopeful that we don't get there, right? We don't have to worry about that. But if we did get to that particular day when we had to make that call, if the information deemed that that was necessary, then we want to make sure and leave ourselves a little bit of room there to say if certain specific groups needed to be on campuses, then they could be. Definitions, we're going to talk about a lot of some new terms and languages and terms and terminology. So we wanted to make sure that we tried to put down some general definitions, so when we reference those things within the document, we would, parents could find it pretty easily. We also tried to list throughout the document, you will see links to things, whether that's CDC guidance or whether that's our own internal documents that we have made to link to those particular links. Let me give you an example of one. You see under face coverings, I think that's pretty self-explanatory what the definition of face covering is. But we included the CDC guidance for that. Hand sanitizer, pretty self-explanatory about what that is. Clean and disinfect, we are using a particular botanical disinfectant that's EPA approved, and that's what we've purchased to use. It's a quick kill and it's a fast dry time, so you can spray it pretty much on anything and it will do it. So we've put on here the link to that particular sheet to make sure parents can read about it themselves and not just necessarily take our word for it. Close contact, obviously, someone who's within 6 feet of a person that's positive for at least 15 minutes. And, you know, we've seen the differing things out there that say 10 feet, you know, and 3 feet of distancing might be okay, but this is what the CDC had at that time, and that's what we linked to it, 6 feet, 6 feet of distance within 6 feet for 15 minutes or longer. The school closure decision box there, we had a lot of conversation around this, and I think it's probably one of the most talked about portions of our early release of information, and that's around the calculation of how to move from green to yellow to red. And really, it's not simple, it's very complex. But we were trying to make it as simple as possible, in the sense that we wanted the most accurate information that we could get, but we also wanted to make it easy for parents to understand and to access. And we learned after we released that we really didn't hit the target very well there. If you go to we've included the link to the Tennessee Department of Health. And if you go to that and you follow what we've said, you're basically going to get the total active cases. That's what you're going to get. Now, there's a lot of discussion around whether that's the most accurate number or not. Probably the most feedback I had from people was simply just use that number. Everyone can go find it. Matter of fact, I think on the Department of Health website, they've recently changed it to where that number comes up. Once you get to your county, I think it's a graphic about that. So we've had more conversation probably around that than any other one particular item. We went back and changed it and said, look, we'll be glad in this definition to use that number that's easy to find. We also want to have a conversation around, we have other information that's important beyond that number. The State Department of Health and the State Department of Education sent guidance to us last week that specifically said in bold, don't solely use that number to make a decision. Okay, don't do that. You need to use other metrics that are available to you to make a decision that's best for your county, your school system. So I say that to say, really, we want it to be transparent and easy for parents to find. But we also want parents to know that, when we have a conference call with Unified Command where we're getting information about our specific county from Sumner Regional, Henderson Medical, from medical directors for the county, EMA, first responders, when all of those folks are on a call once, twice a week, daily, every day, you get a lot more depth of information about really what's happening. So we went back and put in the easiest way, which is solely that active case count number, right? But we also want to make sure that the board understands as we move through this process of reopening schools, we have access to other information that's specific to Sumner County that may or may not influence that in the future. Does that make sense? So I think it would be disingenuous to say we don't want to use that number because we do. But we also want to make sure people realize that we're going to have access to other information as well. I mean, Ms. Hawkins sent something today to me about Georgia Tech, a formula for Georgia Tech uses, and it was great. I went on there and looked, and there's a lot of information and data out there now that we didn't have access to in April and May. It's just the truth. So we don't want to necessarily say we're going to use our own metric. Okay, we're not saying that. We're saying we're going to go with the active case count that everybody can see. But we also don't want to ignore all the other data that's out there. I think that would be equally bad. I think is what I'm trying to say. All right, learning and communication platforms. We have some new terminology here, basically around the Sumner Virtual Academy, Sumner Connect, Google Classroom, Remind, and School Messenger. And so the Virtual Academy, obviously, an alternative method of instructional delivery for students K-12. Students will receive online instruction and assignments for at least 9-week increments, and that's kind of what I talked about. We want you to choose. We're fine. We want that option out there for parents. We want them to feel good about being able to continue receiving their education, child's education through our system, and we're going to support that. But we just want them to make a decision that we can stick with for 9 weeks or semester if you're in high school. Sumner Connect provides training tutorials for parents to navigate Google Classroom, Skyward, and other Google tools. And I know that's a lot about what Gene's going to talk about and Scott's team later on. Google Classroom, a teacher-specific virtual classroom where students engage in learning and receive and turn in assignments. Remind is a two-way communication tool for updates between teachers and students and parents. And then School Messenger, I think our parents are used to these two already. An automated notification system that allows us as school administration to communicate with families via phone call, email, or text. And that will be important later on in the document when you see how we're going to message to parents about someone being in close contact with a COVID positive person at school, okay? All right. School schedules. In the green box, we have really two things that go from that front flow chart. The first one, obviously, is traditional, which is normal classroom schedule supported by Sumner Connect and Google Classroom. The second one, bullet point, Sumner Connect and Google Classroom available for students and families directly impacted by COVID-19. We know this is going to happen. And that's kind of, you'll see later on in the plan how we've got it structured, but we know that we're going to have students that are going to be in close contact with someone that's positive at school. And so we've tried to think through how parents would be notified so they know exactly how that's going to happen, and then what protocols and processes are going to take place once that occurs, okay? We also know that students that have that exposure, that self-quarantine, are going to need resources if they're asymptomatic while they're at home, right? Before they return to school. So that's why you see sometimes through the document you'll see if they're directly impacted, that's what that means. So we can provide education while they're at home on quarantine. Sumner County Schools may move to a hybrid schedule in this stage in all or in part based on consultation with the health department in using those metrics. So all we're trying to say there is that in the green, we could move to a hybrid scheduling model if we felt like we were trending that way, and we needed to do that. Daily attendance and grades will be recorded across all learning platforms. You're going to see that consistently. And I think that's something that as we message to parents that we will have some very specific information around attendance and how we're going to collect attendance. And especially if they choose the virtual option. Later on, I think we'll talk about that in some of the presentations. So you'll get some detailed information about how we're capturing attendance and how we're going to do grades for virtual and hybrid as well. The Sumner Virtual Academy is obviously a new option for us. Full semester commitment, 9-week commitment for K, and then of course daily attendance and grades will be taken if you choose that model. The moderate, we went with hybrid schedule for students supported by Sumner Connect. We actually have linked the hybrid schedule section, and we'll talk about that. In a minute. I think it's pretty sure we put that in the back. Yeah. If you flip over to page 11, you will see that we went ahead and based on input and feedback from our principals and from parents and teachers, we went ahead and developed what we believe will be the best hybrid model for us to take, implement. And you see that on page 11. JJ, you want to find it on there so they can see a little bit of it? And basically that's last name. We're going with last name because we think that keeps families together. But we would do a Monday, if your last name was A through K, we would do a Monday and Thursday at school. If you were L through Z, we would do a Tuesday, Friday, and then everyone learns from home on Wednesday. And of course, that's a day that's important for our teachers to do some intervention and some other work with students while they're at home. But all of us, as far as the staff, at our school locations, okay? So we would be all at our school location to work together to do that. So that's kind of the schedule model, the hybriding schedule model that we kind of settled on for that particular section. Sumner Connect and Google Classroom obviously will be used to support students when they're learning at home, whether they're not at school, on school campus. If we move to that model, we're looking at doing that in 10-day segments. One thing that we talked about, we don't want to put parents in a position where we're moving all the time back and forth, right? That's why it's important to look at the trend that is occurring with new cases across the county. And so we want to make sure that we give parents an opportunity to know for the next 2 weeks, this is what we're intending to do. Does that make sense? So we're not every other day or once a week making a decision about the following week. We think that's more fair to parents, and it's teachers as well. So we're looking at 10-day cycles. So if we were to go to a hybrid schedule model, then we would do that with an announcement that we're going to do it for 2 weeks. And in the middle of that cycle, we would make an announcement about whether we were seeing progress on our active case count and the metrics that we have, the information we have, and that we would move back to either traditional full everybody on campus, or we would stay in the hybrid. Daily attendance and grades and be recorded, and then all Sumner County School employees report to work at the same location that they typically work, because we're going to have half of our students every day in that scenario. And then substantial basically means that all of our employees continue to report to work, but we would be doing everything remote. Like I said earlier, select students may be in buildings, just not sure if that would be necessary or not. And then, of course, daily attendance and grades would be taken across all those learning platforms. The next thing we're going to talk about, a pretty big section we call practicing prevention. And these are all the things that we're trying to do in the green, obviously, to prevent the spread of COVID. First thing, maintain daily communication with state and local health officials. You know, we, Lisa, her team, stay in constant communication with health officials, whether it's at the state or local, not only with folks that are in the health department, but physicians about what they're seeing and frontline folks. So we have a good connection to folks in the medical industry and the health industry, health officials, to make sure that we're getting the most accurate information. Participate in contact tracing, obviously. That's something that we're going to comply with and we're going to do, and to help the state and local health departments contact trace once someone tests positive and we know about that. Parents should screen their students daily for symptoms, including temperature checks prior to entering the school. We attach the questions under the self-screening tool, and I know you probably have all been asked those questions, 4 or 5 questions about your fever and those kind of things. So we want to make sure parents have access to those questions and that they self-screen. We had a large discussion about temperature checks, and we landed on, I think this is later in the document, we landed on checking temperatures in midday. And the reason for that is because we felt like parents would be responsible and check their child's temperature before they come to school. And if they have a temperature, then obviously we're encouraging them to stay at home. So we felt like doing it in the middle of the day would give us the best chance to obviously catch someone that maybe didn't screen that morning with their parent, but did with us, and that would give us a better reading than doing it as they enter school. Yeah, right there it is. Midday temperature checks. So it was right below there. I didn't see it. Face coverings are strongly encouraged but not required unless legally mandated by state and local officials. Reusable face coverings provided by the state of Tennessee will be made available to staff and students. So we will have some that are available. Most will probably obviously choose to wear their own, right? But we will have some that are available that are reusable that we can issue out to students and to staff if they choose to wear them. I know that the mask, obviously, depending on the mayor's order and whether that gets extended or not, changes a little bit of the conversation about the mask and whether we require it or we don't require it. I know probably there will be some discussion at the board level, this level, about the mask and whether we should or shouldn't mandate those. I have consistently landed that whether you mandate it or it's part of an order, or we strongly encourage it, I think we still wind up in the same position that you're going to have folks that want to wear the mask because they think that is the responsible thing to do, and then you'll have some folks that think they shouldn't have to wear the mask, whether they have a reason for that, or whether, medical reason or other situation that would exempt them, or whether they feel like that's not the best thing for them to do. So you get kind of caught in that, and the debates that I've heard from other school districts, I think everyone's centered around whether to do that or to not do that. We've taken the position that we're going to encourage it, strongly encourage it. We're going to, obviously, as we're doing tonight, encourage it by action. We're going to ask people to be mindful and thoughtful that you're not only impacting yourself but others, and so be responsible and wear the mask. I will say that as we move forward to reopening, if that order does get extended through Mayor Holt, then obviously we'll take that into account with what we tell our staff and other individuals that will be coming into our school. Obviously, we've talked a lot about having hand sanitizer and those kind of things available, so we'll encourage students and staff to bring their own. I know most have those. I don't know if you guys are not, but I've never really kept up much with those smaller bottles of hand sanitizer, that you get for use and stuff, but now we do, and we keep up with them. You have them in your pocket or you have them sitting around. So I think a lot of our students, especially the older students, will probably bring some of their own, but we'll have that available. We'll encourage them to use it, obviously. Teach and reinforce good hygiene measures such as hand washing and covering coughs. Minimal use of shared supplies. I think that's a big one that we can plan on and try to avoid using shared supplies. Provide hand soap and hand sanitizer. No touch trash cans in the bathrooms and classrooms and frequently traveled areas. Strategic movement of students where feasible, and this is one of the areas where the principal specific plan that would be more specific to their building, and so you'll see some of that kind of conversation in the school specific plan. Post signage in classroom hallways and entrances to promote good hygiene and those things, and you've seen those types of signage probably already, and we'll use those. Clean, disinfect it frequently. High touch surfaces at least daily, and shared objects after each use. And then of course we linked again the disinfectant solution that we're going to use along with other cleaning products. We want to make sure we put that one in there because parents probably wouldn't be familiar with it like they are Lysol wipes and those kind of things that are more commonly known. Water fountains closed, so we won't be using our water fountains. Water bottle filler stations will be available, and we have those in most of our schools now, or many. But we are encouraging students to bring their personal water bottles so they can refill it because the water fountains will be closed. Plexiglass shields at the front office areas where we have most of the traffic coming in to our front offices. So Andy and our maintenance teams have built those. I've also asked him to build one additional one that's portable, because as I talked to principals, they said, hey, we really have that front office area where parents come in, and that's where most of our traffic's at as far as coming into the school. We'd like to have one there, but we also might need one in our attendance office where students come to bring their excused absences and those kind of things. Sometimes parents come in and talk to the attendance clerk. So that might be one example of where they needed one, where another school might use it in a different area. So I'm sure as we reopen, there will be requests for Andy to make more of those. And we're fortunate we have a great maintenance group, and we know we're going to have some at every campus, but we may continue to make those until the need goes away. And then obviously we'll have a deep cleaning of schools. We've already done that in preparation for the start of the school year, but especially during weekends and holidays. And I do think with a hybrid schedule, that Wednesday does allow us to do some things that we might not be able to do if we were on a traditional schedule. And then when students or staff members present with COVID-19 symptoms or test positive, we follow the protocol, and we'll go through that specific step-by-step protocol. In addition to minimal section in the yellow under practice and prevention, again, we're talking about face coverings and issuing those reusable ones, having them available for students and staff. The yellow, obviously, student numbers would be reduced due to the hybrid schedule, so we would only have half of our students there on any particular day, and that certainly would help with social distancing and other measures of how you move students on the campus. All right, and then flip over. I'm going to skip the supporting teaching and learning. Mr. Langford, I think, is going to cover all of that and probably a whole lot more, so I'm going to leave that to him and his team. Student attendance. We knew parents would have questions, obviously, about how attendance would be taken, especially if they chose the virtual option. They would be worried about, we thought they would be worried about parent notes, which we accept. They would be worried about COVID-related illnesses or possibly quarantine situations where they're at home because someone in their home tested positive, those types of things. So we tried to think through all of that to the best of our ability and include those types of answers within our document. Obviously, daily attendance to be taken. We've already mentioned that. Daily attendance and grades across every platform, regardless of what's chosen. Current attendance policy allowing 5 parent notes per semester and doctor's notes will be accepted. So we're going to accept that whether you choose the online version or whether we're traditional or in a hybrid, either one. All COVID-related absences will be excused with a parent's note or a doctor's note, okay? So we get into that situation where parents maybe say, well, you know, I don't know why you didn't just do unlimited parent notes. Well, we basically have. If you write us a parent note and you say it was COVID-related because you have someone that you've been in close contact with, then we'll excuse that. So I want to make sure that people understand that we're going to do everything we can to make sure that children get the resources and education that they need and they deserve to get. But if a parent's nervous about it and they say, hey, my child's going to be absent, whether they're in any learning platform, we're going to make a way to get that excused, okay? Email to your school's attendance clerk is preferred, and I think that's probably the way most of them are handled now. Some bring them to school, but there's a lot of email communication that occurs between the attendance clerks and parents, I think. Certainly, if they email them that their child's out because of a COVID-related absence, then they don't have to come in, so there's less contact, right? So I think that's probably why we think that email may be best. If a student is absent from the traditional classroom due to being COVID positive or symptomatic, we have 3 things down here. The parent must communicate to school the reason for the absence, obviously. The student will be counted present by participating in the Google Classroom assignments that they'll be assigned. And then a negative test result or return to school note from a healthcare provider should be presented prior to the student's return. And we had quite a bit of conversation around this portion and the detail of this. But we also felt like, you know, if we know someone is COVID positive or symptomatic, then we needed that return to school note, which is not atypical for us, even with other illnesses that are not part of a pandemic. So it's not too far off the norm for what we typically do anyway. But we felt like that was a level of protection because we know we've been notified that they're positive. We want to make sure that we can have those students come back after they're symptom-free. They can come back and they bring a note, and we know that they're safe to return to school. In the yellow box, daily attendance will be taken, obviously, Google Classroom. And then the Virtual Academy, I think Scott will talk about this later. Attendance is based on participation in online work sessions, learning sessions, and the assignments that they complete as part of their participation in the Virtual Academy. And then, of course, the red box, everyone would fall into that category of remote learning. and they would be counted at present based on their participation with their assignments that are assigned to them through their teacher. All right, let me see here. Student transportation. I knew there would be some questions about transportation. So a couple of things that we're going to do that are a little bit different for us this year. Hand sanitizer, Clint got permission for us to mount some hand sanitizer stations on the bus as you enter the bus. So students will have free access and free choice of that. We didn't think it would probably be the safest or most effective way to have a pump bottle that the children either used, shared, or a driver squirted in the child's hand as they got on the bus. We thought that probably wouldn't be the best thing. So we did get those mounted, and so that will be on every bus in the same location as students get on the bus. Bus drivers and students will be required to wear face coverings while on the bus. Students without a face covering will not be permitted to board the bus. Let's talk about that, because that's different. We know, regardless of how well we plan, if you look at the CDC guidelines, did you guys read those? Okay, they've changed several times, but every time when you read the section about how we're going to transport students and we're going to have one per seat and skip every other seat, we'll never get when we run bus routes at 4 o'clock in the morning, we get home about midnight. And that's just the reality of it. Remember when I told you we can only do things that we can implement. If we can't implement it, there's no need to do it. So Clint and student transportation is one of the sections that we had to say, hey, we can't guarantee you or even have a successful shot at social distancing on every bus, on every route, right? We just can't. So we thought the best thing to do would be to require face coverings, because we can't, with a high degree of success, practice social distancing on the school bus. Does that make sense? So that's why we said that, because we felt like this was an area that we needed to go that extra step right off the bat, just to make sure that we could try to protect students and the driver. We put on here that parents are encouraged to use other methods of transportation, and I've talked to a lot of parents, and they've said, my children used to ride the bus, but we're going to make other arrangements this year. And we want to be upfront to tell them, hey, we think that's an area where we require face coverings because of the things I just mentioned. But obviously that's a decision if you can make, that probably would be best. Limit field trips. I've said limit field trips, but basically I've told the principals, look, we've got so many things to do to get school started, and whatever method we choose, that we just need to focus on getting those things done and not do field trips. So I know it says limit there, but I'll just tell you what I mentioned to the principals. We just need to don't be planning field trips for the first 9 weeks or so while we're trying to get school going. We've got plenty of other things to be focused on right now. Utilize space seating, and of course we're going to do that, but as I mentioned, with our routes and the numbers on our routes, it's going to be tough even if we have reduced ridership across the county. We are going to clean and disinfect between morning and afternoon routes, and after each afternoon route, when the bus is finished for that day, we'll clean it again. And so I know Clint and his team will do a great job with that. I did put down routes may be canceled based on driver availability. I don't think it's any secret that we have recruited, and I think, Clint, probably we probably in better shape right now than we have been for a few years. Is that pretty close to accurate?
That would be correct.
So that's a good thing. But last year at some points we were down 40 drivers, maybe, from being fully staffed. So we were already doubling, tripling up routes, and Clint and his team do a great job. But I say that to say, if you have 2 or 3 or 4 drivers that for some reason are unavailable and we can't run routes, I want parents to know that up front, that we may have to make some modifications this year because we have drivers out that we can't run routes. And we've not had to do that before. We've always been able to run the route. But we may be in a situation where we can't, and I don't want that to be a surprise or a shock to parents, right? So I'd rather talk about it now, ahead of time, so they know that we may be in that situation. Depends on circumstances with our drivers. And then in the yellow box, I put eliminate field trips, but I already mentioned that. We're going to, right off the bat, eliminate field trips for the first 9 weeks. Just try to get focused on the things that we need to be worried about. Building use, implement standard procedures that we've already outlined in the practicing prevention. Limit unnecessary congregating of students and staff. Limit non-essential visits such as eating with students, parent volunteers, PTO activities. Strongly encourage all visitors to wear face coverings. You know, we want to make sure that we, in this time, are thoughtful about people coming onto our campus. We don't want to make people feel like we're not welcoming and that we don't want them there. But there's also a balance to say, can you just be thoughtful and mindful that if you don't really have essential business at school, that maybe you don't come as often. One of those is, you know, we have great events every year with grandparents' luncheons. We have things that we do that are traditional for us to do in the fall with Thanksgiving and those kind of things. All I'm trying to do here is just give people understanding that we're going to ask you to do some things, maybe not do some things that we typically do, that will be a little different this year. And it doesn't mean we're giving up on traditions, and it's not that we're never going to go back to doing those things. It just means we're having to all make some sacrifices here to try to open schools in the safest way. And so that's really what we're trying to get across. Visitors should screen themselves for symptoms, and of course that's personal responsibility, kind of like we talked about with parents doing that with their children every morning. And then non-school groups, we're really going to limit the use of our buildings by non-school groups. And all we're trying to do is just make sure we provide the safest place possible. If we have a lot of foot traffic after school with non-school groups coming into the building, it makes it a little bit more difficult. So I think we've probably already spoken to most of those groups that use our buildings consistently and told them, hey, we would like for you guys to be looking for an alternate place to do these things. And they've all been very receptive to that, to my knowledge. Serving meals or school breakfast and lunch. Obviously, we're going to do all the things that we talked about with practicing prevention. A couple of things that are of note here that I think will be important to you and important to parents as they look at kind of our plan. We'll use disposable trays and prepackaged utensils this year. That's a decision we made early on. And Andy and his team and Jennifer got that lined up. So disposable trays and prepackaged utensils will eliminate self-serve. So we will not have self-serve this year. And that's been something that obviously has been a trend that we've been doing for a while, but that's not going to happen this year for obvious reasons. School-specific serving plans will be posted on the school's website. That goes back to that school-specific plan that you'll hear a little bit from principals. But, you know, we have cafeterias of different sizes, different numbers of lunches. We have a mix of how that's going to look. It's going to be very specific to that school in their schedule. And so that's why those parents will be able to look at their specific school plan and find that type of detailed information. School serving plans will be designed by the school administration to reduce the number of students in the cafeteria at one time. And then we listed some things there that were considerations, but as I mentioned, each school principal has developed a plan that will include that kind of information. The next section, student transitions. And obviously we'll do all the things that we talked about with practice and prevention in the first big box. And then put in school transition will be dependent on the school. And that'll be something that, once again, is very building specific, and principals will talk about. And whether that's how they're going to move and transition students between classes, as groups, those kind of things will be in their particular building plan. In the yellow box, obviously, we talked about face coverings again, limit exposure between groups of students where you can, for class changes and other transitions throughout the day, provide additional time so you don't have as congested a hallway with traffic. Designate areas of hallway, of course, obviously that's easier in the elementary school than it is in the middle school and the high school, right? Because they're used to doing that, walk on the line, walk on the colors of the tile, that kind of thing. Plan staggered classes, which we may have some principals that have designed theirs around how kids swap between classes across hallways and those types of things. And then have students stay with the group, same group of students during the day. And I know some principals have talked about how they could do that within their building where those particular students move with each other so they don't mix with other students in case there's a student that's positive in that group from exposure. And then one thing that we spent a lot of time on, and I think this is the detail that maybe in other plans I haven't really seen, and that's around what we thought would be important to parents about how am I going to be notified? What's going to happen if someone's positive, my child has been in close contact with someone that's positive, or what do I do if someone is positive in a home that a student lives in, or maybe even a staff member lives in? So we tried to think through that, and so I'll kind of go through these, and of course as they sink in and we go through the rest of the process tonight, then you can obviously ask questions about it. When a student or staff member tests COVID-19 positive, this is what we're planning to do. If they're COVID positive, we'll assist the local health department in contact tracing because that's what we're required to do. Using School Messenger, the school will notify staff and parents of students that have come in close contact with a COVID positive individual at school. We put in there using School Messenger because parents are used to getting that communication. We also wanted to make sure that we set the expectation for parents because if you think through this and you say, okay, this situation may occur where we have to contact parents in an elementary classroom, so that's 22. Which sitting down and calling 22 obviously would be the ideal thing. But we're going to have a lot of other things going on as well, so we want to make sure parents know that they may get that School Messenger call to notify them that has occurred, okay? But we tried to include enough detail in this document they would know what steps would happen next. Staff who test positive, kind of split it up here. Staff who test positive for COVID-19 should report this to their supervisor or principal immediately. That's pretty understandable. The supervisor and principal will contact HR. HR will work directly with the employee on the federal requirements as it relates to COVID-19 because it'll be very specific of how we do that with someone that does test positive and what they qualify for as far as leave and other things through federal law. The school will restrict use of impacted workspace for cleaning and temporarily move activities to another space in the school. There, we're just simply trying to say we're going to isolate that area to make sure that we have it cleaned and things are appropriate before we would let students or staff back into that area. COVID-19 positive students and staff must submit a return to work school letter from their healthcare provider before being allowed to return to school. And I think that's pretty standard protocol for everyone at this point. And then students who are directly impacted by COVID-19 can continue learning at home via Sumner Connect and Google Classroom. And that's when I mentioned early about students that were impacted. That's what I meant. Through this section, if they're directly impacted, then obviously self-choosing to quarantine, even if they're asymptomatic, they would need classroom instruction during that time. Parents with COVID-19 symptoms at school or presents with COVID-19 symptoms at school. So if they're symptomatic, we kind of split it into two sections here, students and staff. So this is someone that's at school, but they're showing symptoms. Student that comes to the nurse and says, hey, I don't feel good. Teacher sends them to the nurse, and they're presenting with at least one of the symptoms that we're looking for. Students who present with COVID-19 symptoms during the school day obviously will be separated from other students, which is not atypical. Once they come to the office or to the nurse and we say, hey, you have symptoms, we need to call your parents. Given a face covering if they don't have one, and evaluated by the school nurse. If the nurse confirms that the symptoms are consistent with COVID-19, parents will be contacted to come pick up their child and briefed by the school nurse about what's going on. Parents are asked to consult with their child's healthcare provider prior to the student returning to the school building. If a COVID-19 test is recommended by the healthcare provider, the student should quarantine at home until test results are back. A negative test result or return to school note should be presented prior to their return. So I don't think there's anything that's really overreaching in that scenario. And then we tell people Sumner Connect and Google Classroom are available to students while they're in quarantine. I think we've kind of mentioned that a couple times before. Staff that feel symptomatic during the day, they weren't when they came to work, but they are during the day. Staff who present with symptoms during the day will notify their principal and supervisor. Obviously, that's going to happen. Be given a mask and have no further contact with staff and students, obviously. Sent home and asked to talk to their healthcare provider prior to return to the school. If their test is recommended by their provider because they're symptomatic, then the staff member should quarantine at home until the results are available, however long that takes. A negative test result or return to work should be presented before they return. One thing that the principals asked us to do was to create a one-page document that dealt with how to handle this section. When someone that's a staff member that tests positive or they're symptomatic at school, how do I handle that as a principal? And so we've kind of lined it out for them about this is what you do and this is what HR does, right? And so that's one of the things that we developed based on the request from the principals. And then we created a section that you come in close contact, and we think this will be one of the things that happens more often. Comes in close contact, but they're asymptomatic. So they're not showing any signs, no symptoms, but they have been in close contact the best that we can tell. We've said here if you're close contact exposure, but you're asymptomatic, using school messaging, the school notify staff and parents of students that have come in close contact with a COVID-19 positive individual at school. We've broken it down between students and staff. Students who are in close contact with someone that's positive are encouraged to consult with their healthcare provider prior to returning to school. Students are encouraged to quarantine at home for 72 hours to monitor for symptoms, which is pretty consistent with everything we've read, that you need to at least stay 72 hours to make sure that you're going to continue to be asymptomatic. Based on consultation with their healthcare provider, and students remain asymptomatic for 72 hours, the student can return to school. Students will be screened upon their return and are strongly encouraged to wear a mask for 14 days from the exposure, which I think is all consistent with what we've read everywhere. Students continue obviously learning at home while they're on that quarantine, trying to make sure that they're asymptomatic for more than 72 hours. Staff's a very similar thing. Consult with the healthcare provider. If the test is recommended, the staff member should quarantine at home until test results are available, and of course that depends on kind of where we're at with the testing cycle that's been as short as a couple of days and as long as 6 or 7, but we hope that gets better. A negative test result or a return to work note must be presented prior to their return. If an employee is not exhibiting symptoms, they may continue to work as a critical infrastructure worker, and we've included what that language means through that link. So it's defined what a critical infrastructure worker is, and obviously we fall into that category. The employee should wear a face covering at all times while at work 14 days past the last exposure, even if they're asymptomatic, and we're just trying to make sure that we do as much as we can to, even though they're still asymptomatic, to not be a spreader of the virus. Next page 14, yeah, 14. When a student or staff member resides in the home with a COVID positive patient, positive individual. So that's one that we thought, obviously, it's going to happen. We've heard about it happening already. Staff that resides in the home with someone that's positive should report this to their supervisor. We've had this situation occur even though we weren't in school, and they still notified us that someone in their home was positive. The supervisor will contact HR, and that's kind of where I talked to you guys about the HR one-pager that we are going to send to principals. They ask us to develop, just so they know specifically what to say and where to direct the employee in HR. Okay. Staff will be asked to consult with their healthcare provider before coming back. If the test is recommended, they should quarantine at home until the results are available, and then get a return to school letter from the physician. Students that reside in the home with COVID positive is a very similar thing. We're going to ask parents to consult with the healthcare provider. Obviously, if someone in their home's already tested positive, then they're in contact with a healthcare provider, okay? And then we're going to ask them to quarantine and before they come back to work, come back to school, they have to have a negative test result. Or a return to school note, which obviously physicians have been writing those pretty steadily for folks to return to work. One of the last things there, a self-screening tool. Families should check the student's temperature. We have those screening questions. Have you been in close contact? Are you experiencing new onset cough, shortness of breath, sore throat, or stomach symptoms? Have you had a fever of above 100.4? Are you experiencing a new loss of taste or smell? And I think those are consistent with what have been out there and recommended that you ask. And we've been using those same self-screening tools for student athletes that are back on campuses and have been since June 1st. We've been using those same questions. I'll be glad to answer any questions. There's a lot of information. And you probably, even though we've thought through all of those scenarios about students and staff and what happens if someone tests positive, and how am I going to be notified and what's going to happen next, what's my expectation to return to school. I know that's a lot of detail, but we've tried to put a lot of thought behind what parents would need to know, what staff would need to know, and then of course, what steps would need to be taken before they could return to school, if they're symptomatic or asymptomatic.
Are you ready for questions, Dr.
Yeah. Yes, sir.
I have a couple of issues. As you know, last time I was the only one that wanted the staff to wear masks. And I discussed it with my doctor at Centennial because they keep up with all that. And he said the difference being it would be 17.8% chance of getting it if the staff wears, and he said only the staff wears masks, it reduces down to 3.1%, which is quite a drop. And he said he thinks that the elementary kids, unless you've got one with an autoimmune or coming down with diabetes or something, he said they're going to be fine. He said the kids don't need the mask like the adults do. He said the adults are going to be your problem, not the children. And also, I noticed on page 12, I who wear a mask, had to go to the dentist for a broken tooth. And of course, I get exposed to COVID. So I had to go to the health department and have it tested. Here's what I'm noticing on page 12, where you say, get a cleared test. I have yet to get my test back, and it's been almost a month. So I don't even have my test back, but I'm way past the quarantine time. So you may need to kind of reword that where you're not dependent on getting a test you're never going to see. It's not the health department's problem, it's the Quest Labs. Just are not returning them. They get paid for them. I don't think they're really worried about it. Then there was one other thing I wanted to mention. will we have face masks on the bus for kids who can't afford them? Because there's some kids do well to have clothes, they're
Yeah.
not gonna have a mask every day.
Yeah, we'll have some available on each bus.
Right.
In case they get to a bus stop and the child doesn't have one. We can certainly work with that. I think you're right about how you're interpreting the ability for us to require adults in the system to wear a mask. Obviously, that's something that we can discuss. We didn't put it in here that it's a requirement, but that's certainly something we can talk about. And the test results, yeah, we've had people that have told us they got their results within 2 days, and then we've had some that they had to call a bunch of times and finally found out. We've heard, where's Lisa? We've also heard that they're going to stop sending negative. Like they're as testing increases the volume, they're not going to send you a negative. They're only going to contact the positives. So and that's one of the things that we heard from the health department. So I guess I'm saying all that to say I think we need to be mindful of that and plan that folks, especially staff that get tested and students, may have a delay in getting the results.
Right, and this is absolutely wonderful. You've done a superb job. And I know I seem nitpicky because I am.
Yeah.
You know,
That's
so
okay.
Y'all are used to that.
That's right. Nothing wrong with
But
that.
it's wonderful. It covers everything I could think of.
Good. Thank you.
Thank you, Ms. Brown. If you're done, if you turn your mic off. Saw Mr. Wilkerson next, so we'll go to him.
The only thing that I see is strongly encouraging all visitors to wear face masks. I think that should be mandatory. If you go into any hospital right now, you have to have a face mask on. And I think that school is a greater risk of transmitting it. And I think if you're a visitor, you should wear a mask.
Yeah, and we talked about that. We've talked about every bullet point on this for a bunch of times, but we talked about whether that would be something that we would need to or want to require. And obviously we can. I think we can say, hey, we want you to wear a mask if you come in. I know the entire situation with mask about being enforceable is kind of one of those things that you can have a debate about that, but at the end of the day, I have faith in our people in Sumner County. I have faith in folks that are going to show up to our schools, and if we ask them to do something, I think the overwhelming majority will do it because we ask them to.
Thank you, Ms. Wilkerson. Ms. Hawkins?
Yes, I have a couple questions.
Sure.
On page 11, talking about the hybrid schedule model, I have seen models where the hybrids had the students, for example, A through K, going to school on Monday and Tuesday. And then there would be a cleaning of the school on Wednesday. And then students L through K would go on Thursday and Friday, and then another cleaning of the school on Saturday. I was just wondering if that was a consideration. And I also was wanting to know how many students are going to be in each classroom.
So let me tackle the first one. We had that exact model in our plan, the one you just mentioned. But when we vetted that with principals, unanimously they said, we think having students go 5 days without seeing their teacher is going to be tough. We would like to be able to have them split. So we actually, based on that feedback, went from what you just mentioned to this one.
Is that in the best interest of the child?
I think that's the reason they said that, because they all said we would feel better about a student coming and being with their teacher on Monday, and then again on Thursday, and then again the following Monday, versus being there Monday and Tuesday and then having to wait until the following Monday to see the teacher again. So That's the reason, but we did have that discussion with principals. The second thing, it's dependent on the school. So if I understood your second question correctly, you asked about class size.
How many students in one room with a teacher?
Well, it would depend on the school. So, every school is going to have a different, it's going to have a different count of third grade, second grade. Our ratios across the system, with the exception of our smallest schools, which is a little bit harder to do, pretty consistent. So if you look across the board and you say, well, the average of third grade is 21.5, 21.6, and you're going to have half of them each day, then, it'd be 10 kiddos.
Okay. And one other question, you're saying masks will be recommended but not required. I would like to see stronger language than that personally. Just no teachers will. But I was wondering, for those who, for some medical reason, cannot wear a mask, could they then instead wear a face shield? If you can wear a pair of glasses, you can wear a face shield.
We didn't talk a lot about face shields, but I think that's something we could consider.
For the protection of the staff and the other students.
Sure. We just didn't have a lot. We talked a lot about the face covering, but not specifically about a face shield. So, just to be upfront, transparent, we just haven't had a lot of conversation in our circle about a face shield. So we did, but only specifically for some job assignments, but not in general.
Thank you, Ms. Hawkins. Mr. Daniels?
Yeah, I think the information you've given us is very detailed, step-by-step guidelines of what happens when, when X happens, here's how we're going to respond. But when looking at how we handle students, staff members that test positive, and what that process looks like, can you walk through exactly how that situation would be handled? So, for example, from a scenario standpoint, I've got 4 kids that are going to be in our classrooms. 3 of them are going to be in elementary school. And obviously, high school is a little different because you may interact with more students,
Right.
whether it be, through the hallways. It may be that you're changing classrooms and coming into contact with different students in different classes. In elementary, you have a little bit more control because you're more likely to be around one group. So if my second grade student is in a classroom and someone in that classroom tests positive, whether that be a teacher or whether that be one of the students, what happens? From what I understand, we're not going to close the whole school down for 14 days. But what is the process that happens for the students in that class that have had direct prolonged exposure to a student or staff that tests positive? And what's going to go on with the rest of the students? I know there's notification, but then what happens? Do all those students in that class learn remotely for the next 14 days? Are they all tested? Or are we just watching symptoms? Can you kind of walk through exactly what that process would look like?
Yep. So I think that's on page 13. We tried to think that through and say, hey, you've been in close contact, but you're asymptomatic, and I think that's what you were talking about. And so if you look, what we're saying we're going to do is, once we're notified of that, of course we have to be notified that's occurred, either through a parent of a child in your child's classroom that has tested positive because they live in that home, right? Or let's say the teacher or maybe one of the children that's in that class has tested positive. So either way, if you come in close contact, we're going to let you know that. And we're telling you up front that we're going to use School Messenger to do that, right? And we feel like most of those parents are going to call us back even after they get that message, and we'll probably still have some direct communication with them. But we know that we want parents to know that we anticipate using School Messenger because it'll be consistent across the system. We're going to let you know, we're going to tell you if it's a student, your student, we're going to say, hey, we encourage you to stay at home for 72 hours, see if if you have any symptoms, if you're asymptomatic or not. If you continue to be asymptomatic, then you can come back to school. because we think we'll have that scenario happen. Hopefully not often, but it may. So we're going to say, hey, contact your healthcare provider. They may say if you're asymptomatic, don't worry about getting a test. Only get a test if you're symptomatic. Watch that for 72 hours. If you're not developing symptoms, then come back to school. And that'll be the process. Once you come back, the nurse will have a list of those students that fall into that category. And when you come back, we're going to ask you to be screened by the nurse. And that's really just an extra safety step to make sure that you're not symptomatic when you return back to school. If that makes sense.
Yeah. So,
And that's what we'll do.
so if a student in a class tests positive, then it's likely all the students in that class will learn remotely for at least 72 hours.
That's right.
And then, okay, all right.
Yep. And the reason we're trying to make sure that we follow the guideline for folks that are asymptomatic, at least for those 72 hours.
Okay, thank you.
Does that answer?
It does. Yep.
Thank you.
Thank you, Ms. Davis. Ms. Andrews?
Yes, when we are talking about the hybrid schedule on that, and we were talking about, like, especially on those Wednesdays when all the students are learning from home, what about our teachers, however, that have students also within our school system? How is that gonna be handled if they're gonna be at the building, but yet they have students that are supposed to be learning at home?
I'm going to let Mr. Langford, I think you're covering that in your section. Are you covering that in your section?
Okay.
I think there's going to be some pretty good detail about that, so.
Okay, I know that's been
I
a
don't-
huge concern
Yeah,
with,
that's right.
with our
And-
teachers and so
mhm.
forth.
And
so-
we've had that asked to us by a number of teachers, and
Okay.
we tried to be thoughtful about how we were going to plan that.
Okay, I'm happy to wait.
Yeah.
Yes, I have a follow-up question
Sure.
regarding whether if a student or staff member tests positive and the whole cluster from that one class is then sent home. Are students going to be intermingling during the day where you change classes and suddenly you're in a different group? Or will there be, I think what I've heard is called cohort learning,
Mhm.
where the same group stays together throughout the whole school day?
So I think that's much more manageable, obviously, at the elementary school to do that than in the middle school. It's possible in the middle school, but in the high school, it's very tough. It's just very difficult. So,
And how, if you have someone that tests positive in one group, but they've been in a
Yeah.
different class with a whole different
I know.
group of students?
Yeah. Yeah, you know, we may have 120 people that we contact trace out of a high school. Because if you have, let's just say you have, and that's why we tried to say, we're going to notify you originally by school messenger, right? Because if you get in a high school setting and you have someone test positive that has 4 different classes, plays football, right? You may not have had close contact, but you certainly could be on the contact tracing list for 70 or 80 kids. And so we just want parents to know we're going to contact you, be transparent about that, because the chances are that your child will be asymptomatic. But we want you to know that, have information, so you can make a good decision about making sure you watch and check their temperature and ask them questions, the screening questions. But we put school messenger because we know we're going to be in a position where we can't sit down and make 80 phone calls until we get you, right? So that's why we tried to use the expectation up front that we're going to use school messenger, not because we don't want to talk to you directly, right? That's not the intent. The intent is we may be in a situation where we're contacting 80 parents one afternoon. It could be a very real thing.
Yes, thank you, Chairman Brewer. I know we've got more of this to go, but it is obvious there's been much work, thoughtful work on this, and I appreciate that. Just following that train of thought, in elementary school, it would be easy to just say, okay, 72 hours in this classroom, because Johnny has been, not anybody particular, Johnny has been tested positive for COVID, or the staff. So you could one classroom could be, they're learning at home for 72 hours. So in high school, if you've got the child that hits 4 different periods and the football team, does the principal, is there to make the call of, hey, we need to close a school for 72 hours?
Wouldn't be the principal, would be me. But, you know, what we're gonna do is we're gonna try, obviously our best to make sure parents are notified and that we, make the best decision possible for that particular school. So back in the front part of the program, of the document, when I said that we may have targeted closures,
Yes.
I did that because if we have 2 or 3 scenarios like that in a medium to small size elementary, I may shut it down, right? Because that's the best, safest decision to make at that time. So we want people, the board, we want parents, we want everyone to understand that based on all the information we have, which some of it may not be accessible to anyone but us because of HIPAA, right? I may know that because of what we see, the conversation we're having with health department, the number of contact tracing effort, the number we're doing, that I'm gonna have to shut it down for up to, 5 days, 10 days to try to get a handle on that.
And Chairman Brewer, thank you. Where are we on the, and I should know this, but where are we on nurses at each school?
Well, we've done a lot.
Have we?
Lisa knows, but we've
I
done.
bet you have.
Yeah, we've done a lot. And look, one thing that I was thinking about the other day, I don't even know if I talked to Lisa about this or not, but I was thinking about, man, I mean, you don't ever want to say that you're even remotely prepared for a pandemic because you're not, right? That's crazy. You're never prepared for a pandemic. But I look back at where we were at with our nursing staff 5, 6 years ago, just in sheer number. And then I think about what we're implementing in this plan and how hard it would have been if we would have only had 18 nurses or 16. And now we have 44, 50 total. So just think about, and I'm very thankful that we were doing that for other reasons, not a pandemic, right? Because it was the right thing to do. And it needed to be done, but certainly that's one of the things I've thought about. I'm like, man, I'm glad we're in a different situation with the manpower we have, not only in number, but the quality that we have in our nursing staff across the county.
So is there one at each school?
Yes. Well, we have some schools where the really small schools where they split.
Yes.
Because the range of sizes we have in our county, to be equitable, you have to do that. But yes, all of them are covered, yes.
Thank you, Ms. Hayes. Mr. Gregory.
Thank you, Mr. Chairman. I'd like to say it's good to be here. I think this is the only place I've been the last few months where 100%, if I'm not mistaken, 100% of all of us have a mask on. I haven't seen that before. And it's also good to be here that I hadn't been given a clipboard to fill out, and my temperature had been taken.
That's right. We knew you self-screened before you came.
Now, something serious. Are we gonna have the registration as usual, as we have done, with some limitations of how it's carried on?
Yeah, and I think Mr. Langford will cover, I think probably some of that's in his conversation, but yes, we will. But we're fortunate, kind of like I mentioned with nurses, we're fortunate because we pushed really hard, Scott and his team last year, to do online, to get our online registration up and going. I don't know if you guys remember that or not, but I'm proud that we were able to do that. In hindsight, that's a good thing because we can do most of our registration, or at least speed up the process by doing most of it online. Now, new student and filing some of the documents, maybe principals have made alterations to how they're going to do that. So it doesn't look like it has in the past.
Right.
But they've already developed those plans out at the building level.
It seems, situations like this concern me more than just what we might call the routine day. I too believe that visitors should wear masks. Volunteers should. Oh yeah, I got a call from a student the other night, that's kind of unique too, that thought that wearing masks, I think the conversation has centered around the mask a lot. Wear a mask, it'd be required that they, this was a high school student, wear them out in the hallway. Because in these large schools, especially the large ones, that's going to be a difficult situation to distance probably than any place is the hallways. So we can make that a mandatory thing, can't we?
Sure. I mean, I think you can say that everyone has to wear a mask. You know,
Is there a law that says you cannot mandate?
well,
that?
I don't know, from a legal standpoint, I've heard lots of arguments both ways.
I have too.
I've heard that we can, I've heard that we can't. I know school boards across the state, some of them are voting on that particular item about a mask to be mandatory. I think it gets down more to whether it's enforceable or not. I mean, I've been a high school principal, I know how it is, and I feel like our principals are caught a little bit in that scenario where they, you know, they don't want to be the mask police. And I think that's what you have to worry about, Mr. Gregory, is not necessarily can you or can you not based on the law. I think it goes back to what I said on my third question, if you remember. You know, we want to try to do things that we can implement with a high degree of success. And I think the first thing when you mandate it, our principals out there going, what do you want me to do if they're not wearing it? If they refuse to wear it, what do we do? I can tell you that's going to be the first question to me is how do you manage that? And I think other school systems have tried to take a position that if they did that, it wasn't going to be a disciplinary action. But to me, when you mandate something, that means you expect everybody to do it.
Right.
Otherwise, you don't mandate it. So I think it's certainly we can have a discussion around it, but it's something that I think will be from a sheer management perspective will be could be tough to do.
One other thing about after-school activities, would that be, if someone was to stay home, could they still participate?
Yep. So
I think they should.
yeah. So we talked a lot about that. Talking
Because
about
other counties are doing it. I knew all that.
Mm-hmm. So Mr. Gregory asked if we thought about parents that chose the virtual option, if their children would still be eligible. We put for extracurricular activities, especially athletics, what we put within the documents that we would follow TSSAA guidelines. Now, look, I don't know what those will be,
I don't either.
but we will find out. I suspect that my gut and what Mike Brown and I talked about earlier this morning, if a parent chose that option for their child, we would still consider them eligible in Sumner County. So they would be able to play athletics.
And I just think that should be, that they should have that opportunity. But I agree with you. I think if they stay at home, most parents won't want them to.
Yeah, and you also have, you know, the other side of that argument that some folks said, well, you know, if they're scared about coming to school because of exposure, then why in the world do they want to show up football practice where there's going to be 85 people? And 80 of them have been at school all day, right? Or half of them in a hybrid. So you have that same, you have that same argument. You could say, well, it kind of doesn't make sense. We kind of tried to have, I think in our group, working group, and I know principals are this way too, we've tried to think through the policy and be as student and staff centric as possible. It's not like I would make that decision about students being virtual and being allowed to play athletics if we weren't in a pandemic, right? I'm not saying I'd make that decision if there were no pandemic, right? But we're in the middle of an unprecedented time here, and I think we need to always lean toward what is the most favorable thing for the student and the staff if we're trying to make those decisions. So that's why we landed on, if TSSAA allows it and they choose a virtual option, we would still consider them eligible to play.
The communities I represent, FFA is very big. In fact, it's one of the 5 best programs in the state. And of course, that group does a lot of, they do a lot of outside activities. I have no idea what their parents are thinking. I just know from the past of activities that I have attended that they have. I'm telling you, they have tremendous support.
Yeah.
And I'll be first to tell you, I would hate to see, and I think we've had one student down here that got well, wait a minute, I said one, about half a dozen, wasn't it, that got full-time scholarship because of that particular program.
We just think that that's the right thing to do for students and parents that feel like that's the best option for them.
Okay. Well, I think y'all done a marvelous job.
Thank you.
This group too.
Are you through? Mr. Gregory?
Oh, I'm sorry. Yeah, I'm through.
Okay, let's go to Mr. Duncan.
Thank you, Mr. Chairman. I just want to share a unique perspective I've had the opportunity to participate in since March. And as a leader of the city of Gouldsville, I've actually been on the Sumner EMA calls. And with that, so is a representative from this school district since the beginning. So I say that to build confidence that this district has been involved in communicating with healthcare professionals, the first responders, the hospitals, with all the test results. They were there when Andy Holt had to make the decision to require masks or not. And I can only make the assumption that they're going to continue that level of communication throughout our county. And I'd like to, again, this is more of a statement than a question, I'd like to commend them for that and thank you, because I can see all of that in this document. So thank you.
Thank you, Mr. Duncan. Mr. Wilkerson, go to you next.
Thank you, Mr. Chairman. I'm assuming that the hand sanitizers that are being installed are the kind you just run your hand under and it squirts it out.
So it'll be a variety. So like on the buses, it's more of a pump, we have, Andy and his team have made some sanitizer stations that will be used that they can put refillable bottles in, because we'll be providing that. So it'll be a little bit of a mix depending on where you're at.
Okay. And are they going to be like in the classroom?
Yes.
For each classroom to have?
Yep. So we'll have plenty in each classroom. We'll have some that are available to students prior to entering the line at lunch. We'll have them on the buses, so we'll have plenty of hand sanitizer available for students to use. And we believe some will bring their own too, especially older students.
All right, thank you.
Yes,
And
sir.
Again, I want, as others have, being in the healthcare industry, I can see that a lot of thought has been put into this, and that we're going in the right direction.
Thank you.
Thank you, Mr. Wilkerson. We've got others that have already spoken, but Mr. Wise, I saw you. You haven't spoken yet, so I'm gonna go to you. So I'll come back to you guys next.
Thank you, Mr. Chairman. I would echo the compliments on our director and his staff and our principals, all of those involved in this. These are tough times, and I think moving forward, the key between our school system and our community is communication. We have to keep good communication, an open flow of good communication between our school system, within our school system, and out to the community as well. That good, clear, quick communication keeps down rumors and falsehoods. So I think that's key. But thank you, Dr. Phillips. Thank you, all of those who were heavily involved in this. It's gonna be a tough time. It's gonna be a tough time. But I think about you. I pray for you, for our students, for our parents, and let's just all continue to work together and do the best we can with what we have. Thank you.
Thank you, Ms. Wise. Ms. Andrews, I'll come to you.
Yeah, so just thinking more on Mr. Daniels' question as far as a student testing positive, I was gonna say, have you considered, I'm sure you have, so I'm gonna ask just maybe for some clarification for parents. So if a student or the teacher tests positive, but like your student is not showing symptoms and so forth, what was the consideration given, thought process on if they're not and the parent felt comfortable sending their kid to school? Was there consideration given that all of those students maybe would then just stay in that classroom and maybe not then do, like, say, related arts and so forth, have lunch in the classroom versus staying home? And then obviously those students who wanted to virtual learn could also do that, considering the fact that if the teacher wasn't the one exposed, would still be required to be in the building.
We did. We talked a good bit about that, and we had originally, back several weeks ago, had in our template that if they were asymptomatic, they could just come back the next day, meaning what Ms. Andrews is talking about. But as we continue to read and research and ask questions, the safest measure is to make sure that you don't display symptoms within a 72-hour period. And so that's why we kind of put that 72-hour marker in there. So we originally had, if you're asymptomatic, you can just come straight back. But then we put kind of that extra step of safety in there about the 72 hours.
I know we talked about too that this plan, obviously there can be some adjustments and so forth. I think as a parent with a student in elementary school, my concern is if my student is in one of those classes, which most likely is going to happen because that's just the reality of the situation, that if we're out for 72 hours and go back to school and then another kid just happens to test positive, then we're back home for 72 hours, you know, and especially if you've got, you know, large groups of kids that are not testing positive or they're asymptomatic, just what that means then. I mean, for myself, it's a headache.
Yeah.
The reality is it's a headache. I'm a stay-at-home mom, so therefore I can do that with my child. For our working parents, for our single parents and so forth, that becomes a different issue for them.
So let's look at 13, page 13. So that's where you and Andy both are. Look under students, and these are folks that are in close contact, but they're not themselves positive. We have said students are in close contact with a COVID positive person, okay, are encouraged to consult with their healthcare provider prior to returning to school. We do that on every one of them because we really believe you should contact your healthcare provider. and find out what's best to do for you and for your child. We also put in the second bullet, and I think that's kind of what we're hung up on right now. Students are strongly encouraged to quarantine at home for 72 hours. So we're not saying you're required to, we're saying that we encourage you to do that. But we know if they're asymptomatic, some parents may send them back. Some may choose to keep them at home for 72 hours just to monitor. But it's kind of like we've said, we understand that scenario is going to happen. And we also understand that the parents are going to make a choice about what they want to do, what they're most comfortable doing, quite honestly. And so if they remain asymptomatic, they may send them back. So I think the second bullet point, they're strongly encouraged to quarantine at home for 72 hours. The third bullet point, based on consultation with the healthcare provider, and if the students remained asymptomatic, then you can return to school. We tried to leave us in a room there that we know there are going to be situations where this occurs, close contact, but they're not positive nor are they symptomatic, and parents are going to choose to send them back prior to the 72-hour run.
Ms. Andrews, Mrs. Hawkins.
To follow up with Ms. Andrews' question, why the 3-day waiting period when we know that the incubation period is longer than that, and oftentimes a person can be asymptomatic? That seems to be, if someone's been exposed, 72 hours isn't long enough.
Lisa, do you want to take that? It seems like a way more medical related question. It's talking about the 72-hour asymptomatic exposure.
So I think the most important thing that you need to hear in that is that we always, we don't want to supersede their healthcare provider's assessment, because their healthcare provider may ask a question and figure out that they weren't directly exposed. They didn't work with that student. But we want their healthcare provider to make that call. So we are careful to say, we don't want to supersede what your healthcare provider recommends. If they recommend a test, we want you to get that. We want you to quarantine until your test results are back. If they say that you need a quarantine for 14 days, don't worry about a test. We can support you educationally while you do that. I just think it's real important for all of these that we really want you to consult with your healthcare provider. We don't want to step in the middle of that relationship, and we want you to follow their recommendations.
Thank you.
Thank you.
Thank you, Ms. Hawkins. We'll go to Ms. Brown.
Yes, I recognize, I know even in the county, there are people without masks on, even though it's mandatory. And I think what we've got to do is come up with some way to make it where they'd rather comply than not. That's about all you could do. And I think isolation does it. Because the type of child that will come in and defy you is the one that will see all their friends. So if they get isolated in the cafeteria and have to do all their work sitting there alone, or 2 or 3 of them spread way out, they're not going to be very excited about it. They'd rather wear the mask than to be deprived their fun day. So I think we can handle by isolation. Of course, during lunchtime, you'd have to come up with a different place to isolate them. But isolation usually works with kids.
Ms. Brown, is that? Okay. Thank you. Mr. Daniels? Yeah. Thank you, Chairman Brewer. I was thinking a little bit about the 72 hours myself when I asked the question, why 72 hours? And I'm not a medical expert, and my wife is. She's a nurse, so she knows more about this than me. But I was thinking, that 14-day incubation period, and what are the odds that somebody's gonna come back? But if a child or staff member is showing symptoms, they might have had it for 7, 10, 14 days as well. So they probably already exposed the other students in the class or around them, to COVID. leading up to when they actually tested positive. Now, I don't know if that's fact or what, but that's just logically trying to think through it. So from a 72-hour standpoint, I do think it makes sense. That the one thing that does concern me, though, is, as Ms. Andrews said, is, you know, what happens when you get in a situation where you have a student test positive, so the students go home for 72 hours, they come back, and 2 days later, another student in that class is now testing positive, possibly as a result of the previous encounter with that student. Now, you've got another, 3 or 4 days, at home. But I think that's where Dr. Phillips was hinting, that that's where you've got to look at. There may be times where you have to look at a school or a classroom or a set of kids where you've got to modify the schedule a little bit to try to make sure that they've got the education they need, but you're also providing the safety and security that the students and the staff need to make sure that they stay healthy as well.
Yeah, exactly. Thank you, Ms. Daniels. Ms. Hayes.
Thank you, Chairman Brewer. I have one more question that followed along. And Lisa, there you are. You're going to answer this for me. In related to the nurse per school, tied to the temperature checks in the middle of the day, who will be administering those to every student? What is your plan?
We actually have a plan for that.
I know you do.
We do, and we've ordered a large amount of thermometers. They're the no-touch thermometers, so it really decreases any kind of interaction, where you're going to be touching students and trying to take their temperature with something other than the no-touch. So we did order a lot of those. We're going to equip the teachers with those. And every building is going to have their own plan, but some of them I've heard are lunchtime is a good time. They're moving, they're washing hands, they're doing things like that anyway. So that will most likely, I would say, be the screening time. May look a little different in middle and high, but I still think it's probably going to follow along those lunchtime signs, those times. And to the 72 hours, I also wanted to mention, I agree with Mr. Daniels, but also that gives us a few days to do some contact tracing for the parents to get in with their physician or consult with them on the phone. And it also did come out in the recent guidelines that the health department sent, or the state Department of Health, Department of Ed, and they gave a document that was in conjunction with each other. So that was also suggested in there.
Do you want to take a break? Because I do feel like I need to bring up that we do have board policy that the meeting cannot go past 9 o'clock, and we can't vote to override that tonight. So do we want to take a break, or do we want to keep going?
Yeah, I think so, maybe.
Maybe keep going. Y'all want to take a break? You want to keep going?
Stand up for a minute, midnight.
All right, let's do 5 minutes in. How's that? 5-minute break. We'll be at recess for 5 minutes. We'll come back at 7:02 or 8:02. I'm sorry.